What about supplementation? Well, there are two supplements that are worth considering. There's a lot of research on supplements, but there are two that are particularly worth considering. One are the omega-3s, one vitamin D. Omega-3 supplementation seems to be beneficial for several disorders, a variety of depressive disorders. Both unipolar and bipolar depression. Very interesting study out in the last year on high-risk youth at risk for a psychotic break. The treatment in the last few years, as I understand it, has been antipsychotics. There's just been a study out in which these high-risk youth were given not antipsychotics but omega-3s, or actually fish oils rather, and the prevention rate, that is the reduction of onset of first break psychosis, was reduced, as I recall, more than with antipsychotics. Correct me if I've got that. I think it was more effective than antipsychotics. But what was particularly intriguing was that whereas with antipsychotics, if you take the kids off the antipsychotics, then they're at high risk of breakthrough into psychosis. With the fish oils, the benefits were maintained over the 9 months study continued after they went off the fish oils. So there's a long-term benefit here. Well, actually, the majority have been most commonly around 1,000 milligrams of EPA, and that which requires about usually on average about 6 caps. But you've got an important point, Barry, and that is most people think of fish oils, take a capsule or two of fish oil. And although it's not yet clear exactly what the ideal dose of EPA, DHA is, the exact ratios, it looks like, as far as I can see looking at the literature, that a good recommendation is 1,000 milligrams of EPA, and that requires usually several fish oil capsules. Good point, and we certainly should be encouraging more than most people think of as, taking a fish oil capsule a day, which just isn't enough. So good point, thank you, Barry. Okay, so therapeutic for several things here. I want to just talk about one other supplement, vitamin D, which has been getting a lot of attention recently, and deservedly so, given that most population studies suggest deficiency rates in somewhere between 2/3 and 3/4 of the American population. More so in the elderly, more so in medical patients, more so in psychiatric patients, and particularly in the obese. So, and I understand that Rebecca's been routinely doing vitamin D levels on people in the consultation service. There's only, I think she told me, if I recall correctly, only found one patient who came back at appropriate levels. Now, there's a further trick here in that the standard recommended blood levels are about 30 nanograms per mil, but that's an osteoporotic benefit. The benefit for cancer, for example, which can be dramatic. There was one of the largest studies, epidemiological studies, looked at the incidence of overall cancer in postmenopausal women, very large study, and found between those who had the highest and lowest quartile blood levels, a 49% reduction in overall cancer rates. And that's not an out of line study. There are others with those kinds of figures. So vitamin D is turning out to be incredibly important for a variety of medical disorders, and shows correlations with psychiatric disorders. I've not yet seen an interventional study, but I'm sure we will. But the trick here is that the normal levels we're given by the labs of 30 nanograms are for osteoporosis. For the anti-cancer effects, you need about 50 to 60 nanograms. So significantly more than we take to be the normal levels. In fact, most researchers in this area these days are recommending aim for blood levels of at least 50 nanograms. Okay? 50, yeah.